Welcome everyone to the Ontario Caregiver Organization's webinar series. These webinars bring together caregivers and subject matter experts to explore topics of interest to caregivers. We do this to support and engage chosen family, friends, neighbors, really anyone who's caring for someone else. My name is Katie Muirhead, and I'm going to be your moderator for today. We begin this gathering by acknowledging the Indigenous peoples of all the lands that we're on today. And while we meet on a virtual platform with people joining us from across the province, I'd like to take a moment to acknowledge the importance of the land we each call home. The land that I'm standing on is the traditional territory of the Haudenosaunee and Anishinaabe peoples, many of whom continue to live and work here today. This territory is covered by the Upper Canada Treaties and is within the land protected by the Dish with One Spoon Wampum Agreement. Today, this gathering place is home to many First Nations, Métis, and Inuit peoples, and acknowledging this reminds us that our great standard of living is directly related to the resources and friendships of Indigenous peoples. As team members at OCO, we are learning about the lands from which we work, exploring how we can be meaningful allies and how we can support the recommendations from the Truth and Reconciliation Commission. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our understanding of local Indigenous peoples and their cultures. We invite you to take a moment to reflect on the land where you are. And if you're not familiar with that, we will be sharing an interactive map that tells you which traditional territory your city or town sits on. And you can find that at native-land.ca. Our webinar today is called Understanding Caregiver Challenges in Rural Communities. Being a caregiver is a challenging journey, and for those living in rural and remote communities, the path can be even more demanding. Today, you will hear from a caregiver who has firsthand experience and knowledge of rural caregiving and get insights on tools and tips and practical strategies for caregiving in rural and remote communities, navigating the rural healthcare system and getting access to the support you need, and building a support network to share experiences with other caregivers. Joining us today is OCO's very own Hannah Albany. Hannah works at OCO as a regional lead for Northern Ontario. Since joining OCO in 2019, she's worked collaboratively with caregivers and community organizations to support their unique needs. She studied political science and social service work and has worked for over 10 years in a variety of roles in nonprofit organizations, including as a clinical counselor and college professor. Throughout her life, Hannah has taken on many caregiving roles and knows how daunting yet rewarding the role can be. Hannah is a proud Northern Ontarian that calls Thunder Bay home and often can be found exploring the great outdoors. We also have Catherine George joining us in a moment to share her caregiving experience. Catherine has been living in Northern Ontario for the last 20 years, but grew up in the Durham region. Caregiver needs has long been a passion for her before it became apparent in her life, as it was a focus of her graduate studies. Her personal experience with caregiving started approximately 10 years ago when her partner started experiencing some difficulties with their mental health. And she is and was a parent and caregiver to their son, who was diagnosed with a rare genetic condition. Her son passed away at 2 years old in December of 2022, and she has a 16-month-old who keeps her anchored. During the first year of her son's life, she signed up to be a peer mentee with OCO's one-to-one peer support program. The relationship left a profound effect on her well-being and how to be a parent of an atypical child while caregiving for her spouse and finding her personal balance and tools for managing full-time work. She is currently a peer mentor in the peer support program and also sits on OCO's caregiver advisory group. So I'm going to turn it over to Hannah now to get things started.
Wonderful. Thank you so much, Katie. So today, due to unforeseen circumstances, Sierra Garrow could not participate in today's presentation. We really apologize for any inconvenience this may cause, but our learning objectives remain unchanged as we endeavor to provide the same content for our webinar. We are pleased to share that we have what we have learned, and even more pleased to have Catherine George here with us today. So our learning objectives for today are as follows. We will go over tools and tips and practical strategies for caregiving in rural communities and in communities that may be far from healthcare supports. We'll talk about navigating the rural healthcare system and gaining access to the supports that you need. We also will talk about building your own support network so you can leverage who you know and how they can help you and share your experiences with other caregivers. So, to start us off today, I wanted to talk about the definition of rural, but it's quite challenging to define. However, classifying areas as rural can be really useful when gathering data and presenting information for decision making, statistical reporting, and advocacy. Common approaches for selecting rural criteria are usually based on variations of population size, population density, and the proximity to urban areas. These approaches reflect the continuum of rural, which ranges from very rural to very urban. The two key dimensions of this continuum are the population of a community and how far a community is from an urban center. Rural communities are generally smaller and further away from services and amenities than urban centers are. And these amenities might be healthcare, social assistance, education, or employment. I also wanted to note that there is a difference between rural and remote. Rural is small populations and or low population densities and a relatively large distance from major urban centers. And remote, it means that their communities are geographically isolated. So they're difficult to access, they're quite a distance from a main route, and they have a small population. So who lives in rural Ontario? Well, there's approximately 2.4 million Ontarians that live in rural areas, of which we know there are approximately 700,000 caregivers. Rural Ontario has a higher percentage of population that's over the age of 55 than urban areas. And this is also true for the age of caregivers in rural communities. Caregivers are less likely to be in contact with healthcare professionals and don't feel like they are seen as important compared to those of caregivers in urban regions. They are the least likely to use services for themselves or their care recipient. And there's a multitude of reasons for this. It could be there's limited resources to access, there could be stigma in their community, healthcare staffing issues, wait lists, etc. Rural caregivers have shared that there are certain activities that are notably more stressful for them. Those include coordinating care, finding services for the person they are caring for, and the financial expense of caregiving. According to Ontario's Ministry of Agriculture, Food and Rural Affairs, rural Ontario's population has decreased from 37% in 1966 to 17% in 2021. So by comparison, the number of people living in urban Ontario has increased by almost 170%. So we know that our rural communities are shrinking as well as they often have a higher age in their population. So we wanted to talk about a few of the challenges with being a caregiver in a rural community. In Ontario, the basket of services in rural and northern communities is less comprehensive, available, and accessible. People in these areas have limited availability and access to primary health care, specialists, hospitals, and community services and supports. There are also gaps in service and coordination with hospital admissions, discharge planning, and follow-up care. And often this becomes the responsibility of the caregiver to manage. You might be the only person who knows exactly what is happening and when, and being able to share this with your care recipient's health team couldn't be integral. Caregivers provide a wealth of history and information and insights that are really important to share with healthcare providers, but it can be exhausting telling your story over and over again. Access to supports and services can also be a challenge. Individuals living in rural and northern communities often need to travel to urban areas to access healthcare services they need. At times, people have to leave their families and support networks and absorb high travel costs in order to gain access to health services that are unavailable in their communities. This can be particularly challenging for caregivers. Often, caregivers will travel with the person they are caring for, and other times they will remain home and try to manage caregiving from a distance. At times, we know that patients and their caregivers have to temporarily or permanently move to an urban center in order to access the treatments they require. As I mentioned before, we know that there are financial challenges, and these financial challenges are greater in rural communities. In a report published in 2020, entitled Eastern Ontario Caregiver Strategy, it noted that rural caregivers face costs about 43.7% higher than that of their urban counterparts due to transportation expenses and the higher costs of prescription medication. It is very well understood that traveling to access healthcare services place a huge financial burden on caregivers. Finding ways to access grants, subsidies, and other forms of tax credits or benefits can be helpful, but as we know, there are some caregivers who may be ineligible for these federal supports, but we'll speak about that a little bit more later on in the presentation. Now that we know some of the main challenges caregivers face in rural communities, we will share some tools, tips, and strategies to help overcome some of these challenges. We will be looking at some tips for navigating services for the person you're caring for and for yourself as well. We know that communities who are further from hospitals need unique solutions to access care. So technology has become essential for providing better access to healthcare supports. We will be sharing some tools, tips, and about using technology as a caregiver. And as I had previously mentioned, finances are an immense source of distress for caregivers, and finding ways to access grants and subsidies and other forms of tax credits or benefits can be really helpful for caregivers. We will touch on a few resources in a few slides. And finally, we will talk about who caregivers can turn to when they are feeling isolated. We'll share some practical strategies to build your support network as a caregiver. Healthcare and community support systems can be really difficult to navigate. Many of us don't know where to start. We don't know what's out there. We don't know who to ask questions to. And it can be particularly challenging for caregivers in rural communities if they're trying to understand multiple healthcare systems. So, like the one in the urban center versus in their hometown. So, some tips that we are going to share for navigating the healthcare system include collaborative care. So, in many rural communities, innovative collaborations have emerged in the face of the limited resources. Increasingly, multidisciplinary primary healthcare teams are being used in northern and rural areas to provide wraparound services. Your healthcare provider may be able to refer you to additional supports like a social worker, a dietitian, or even a foot care clinician. We know that communication is important in all aspects of our lives, but when you're navigating the healthcare system, it can be really important as the caregiver because you will likely be responsible for cross-provider communication and for providing that continuity of information from one healthcare provider to the next. Communication with your care recipients team of healthcare providers is crucial. In order to communicate effectively, it's important to identify yourself as the caregiver and this ensures that providers know who to share information with and that they may ask for information from you. Many caregivers find it helpful to have a dedicated notebook or binder to keep medical history and information. And OCO has a resource that's called the My Healthcare Journey Binder that can help caregivers with keeping all of that information in one place. Having information about your patient's care and recovery can be a really important part of your caregiving role. Yet, Ontario's health privacy laws and rules can make it really difficult for both healthcare providers and caregivers to understand how they can communicate effectively while ensuring patient privacy. When caregivers and providers have a better understanding of health privacy laws, it can help everyone feel more informed and empowered to make these laws work to support the best possible patient care. OCO has developed a number of resources to help both caregivers and care providers understand the consent and privacy requirements in legislation so they can work as partners in care to optimize care and support for patients. And finally, we encourage you to ask questions. Don't be afraid to ask healthcare providers questions. Before medical appointments, it's really helpful to reflect on what you want to get out of the appointment and what questions you have going into it. If if during the appointment the conversation is moving too fast or you're missing information, be upfront with it and ask questions for clarification. It can be helpful, like I mentioned, to write things down, or even sometimes, if healthcare providers are comfortable with it, you can sometimes record that conversation so you're able to reflect back on it. If things aren't clearly explained, it's really important to ask what to expect regarding the person you're caring for condition, its anticipated trajectory, and what to expect in terms of your caregiving role. Rural caregivers recognize that healthcare providers in their rural areas could provide them with more support. Typically, rural healthcare providers are knowledgeable about the services and supports that exist in the community, and they can use their knowledge of the caregiver and the care situation to point caregivers to appropriate services. Many rural healthcare providers recognize that there are limited services available, though, and offer creative solutions that are often needed in order for the caregiver and the care recipient to be properly supported. In Ontario, recently, pharmacies were given the authority to prescribe certain medications without having to consult their family doctor. According to the Ontario Health website, pharmacists can assess and prescribe medication for common ailments like pink eye, seasonal allergies, and skin rashes. And they can also extend prescriptions for chronic conditions until your next doctor's appointment. For caregivers who might find a trip to the pharmacy a lot easier than a trip to a doctor's office, this could be a lifeline of support in a lot of rural communities. Home and Community Care is also an organization that's out there to support people and their caregivers. And if you feel like you or someone you know would benefit from healthcare support at home, at school, or in the community, Home and Community Care support services can open the door to a world of options and opportunities. They are able to provide a wide range of healthcare services and resources that are all covered by the Ontario Health Insurance Plan, or OHIP. And it can be provided in a patient's home or in a nursing clinic. And you can simply call 310-2222, no area code needed, to make a referral. And the referral doesn't have to come from a healthcare provider. Anyone can put in a referral to the Home and Community Care Support Services. And for caregivers that are already involved with home and community care, we encourage them to update their case coordinator if the needs of the care recipients change. The care recipient might be eligible for additional supports when they have changes in their health. We also know that there's many community service organizations in your community and available provincially and nationally. Some organizations like March of Dimes or Alzheimer's Societies or the Heart and Stroke Foundation may offer different opportunities, programs, services, or assistance. Each organization and community offer somewhat different programs and services. So sometimes contacting someone at the organization is the best way to learn what they offer and if you or the person you're caring for qualify to access those services. And if you're not sure where to go or who to turn to, you can always call the OCO Caregiver Helpline. And I'll speak more about the helpline, give a little more details on our next slide. New technology can be daunting to use, but let's take a look at some tech that might be able to provide additional support for you as a caregiver. This is by no means a comprehensive list of the technology that could be helpful, and I'm sure there's new things coming out every day that could be of benefit for caregivers. So we really encourage you to share if you have any resources that you've used, pop them in the chat, and we would be happy to hear that and share it amongst the caregivers that are on the webinar with us. So telemedicine. A study during the pandemic found that the ability and ease of virtual doctor's appointments and online or remote access to healthcare professionals to be a really positive experience. However, there are limitations to internet access that can be problematic for some caregivers and may be an additional factor in the limitations of the healthcare services they can access. Healthcare providers are increasingly offering to see their patients by video or phone. And by maximizing access to care and minimizing travel and wait times, virtual care makes healthcare delivery more human, efficient, and equitable. The Ontario Telehealth Network, or OTN, is frequently used by healthcare providers to connect with caregivers in rural communities, but there are a number of different platforms that providers use. Formerly known as Telehealth Ontario, 811 can be accessed by phone or online to get healthcare advice, help navigating the healthcare services, and to find out more information. You can connect with a registered nurse day or night for free, secure, and confidential health advice. It's available in both French and English, and I believe in up to 150 other languages through translation services. It's of no surprise, I'm sure, to all of you that the internet has an abundance of resources and information that might be helpful in your caregiving role. Websites like Canadian Virtual Hospice, Care Channel, and many others provide a wealth of information, blogs, articles, online learning, webinars. There's endless information out there that could be beneficial. But it also can be quite daunting. If you're not sure where to start to find what you need, we will be sharing some resources and some websites in the post-webinar email. And we are always learning about new resources that are available to caregivers. Like the VHA home healthcare website offers resources for unpaid caregivers. And just yesterday, I learned of an organization called the Gateway Center of Excellence in Rural Health, and they they specialize in understanding rural health and how being someone that lives in a rural area can impact your health. We also at OCO have developed a number of toolkits. One of them is the I Am a Caregiver toolkit, and it walks caregivers through key information that can help them in their role and how to develop a support team, understand their own needs, and how to take care of themselves in order to avoid burnout. We will talk about this a little bit more on another slide. And with burnout at an all-time high, caregivers need their own support networks and a contingency plan for the person that they care for. OCO has free contingency plan and emergency plan templates that can assist you in planning ahead and help give you that peace of mind. We also know that approximately 70% of caregivers are balancing work alongside their caregiving responsibilities. And so we have developed a toolkit for working caregivers who are trying to find that balance. All of these toolkits will be included in the webinar's follow-up email. And finally, the Ontario Caregiver Helpline is a one-stop resource for information and referrals. It connects caregivers to the support they need and the support that the person they're caring for needs. The referrals might include respite or a support group or programs for the person you care for. The helpline is not a crisis or counseling line, and it is available in both in French and English and many other languages through translation services. I also just want to recognize that not everyone can afford or have access to the internet and electronic devices. There's still a lot of disparity about where in rural communities people are able to access high-speed internet that is reliable. So there are still many other options to assist caregivers in finding support, like calling our helpline or 211 to get that conversation started and see how they can access the support in a way that's appropriate for them. So now let's spend some time talking about finances. As we've already said, it can be incredibly expensive for transportation, medicine, equipment, and this list of resources or supports is not all encompassing, but we hope there's a few resources that you learn of and that you know about these sources that might be able to support you. First one we want to mention is the Northern Health Travel Grant. It's a program that offers financial assistance to Northern Ontario residents who need to travel long distances for specialized medical services or procedures at a ministry-funded healthcare facility. For eligible applicants, travel grants are based on the distance you need to travel to reach the nearest medical specialist or ministry-funded healthcare facility that can provide you with the required healthcare services without delay. We will share the link for more information about the Northern Health Travel Grant in the post-webinar email. According to Service Canada, the Service Canada website, EI caregiving benefits provide financial assistance while you're away from work to care for or support a critically ill or injured person or someone needing end-of-life care. You can receive 55% of your earnings up to a maximum of $668 a week. As a caregiver, you don't have to be related to or live with the person you care for or support, but they must consider you to be like a family member. There's more information about this, the EI caregiving benefit on our website and on the Service Canada website. The Canada Revenue Agency is also an area you might look to for some benefits or grants. Living in rural and more remote communities puts a larger pressure and additional costs on and expenditures, but you might be able to find a way to claim it back. By no means am I a financial representative and do not know all the specifics, but we do know that by doing your income tax yearly, you can access tax benefits and credits you may not have known about. But you have to do your taxes. You may be entitled to claim medical expenses in your income tax, so don't throw away those receipts. See if you can use them. And if you're not sure, we encourage you to contact the CRA and find out what you are entitled to. There are many local, provincial, and national organizations and charities that may be able to provide a variety of funded programs and services. This includes local faith groups and service organizations like Rotary clubs. For example, Ceridian Cares is an employee-driven charity that makes a difference by supporting people and improving the communities in which they live and work. They are able to provide they are able to provide financial assistance to families that require that support. There are also local smaller initiatives like in Fort Frances, there's a charity called the Fort Frances Community Chest that provides financial assistance for medical emergencies. So you might be able to find different different things that you are able to access in your community by asking people around you and healthcare providers and even other caregivers in your community. Finally, the Benefits Wayfinder is an online tool that simplifies the search for government benefits toolkits for people seeking ways to boost their incomes and or reduce their expenses. There are a few different places that you can go to find these tools, including Prosper Canada and the CRA. And again, this information will be included in our follow-up email. Finally, we know having a strong support network can be extremely helpful. Caregivers rarely think about their own needs, but it's important you take care of yourself to avoid health issues of your own. We know that rural caregivers look to their primary healthcare provider more than caregivers in urban settings, but the healthcare provider may not be the only source of support. From a study that was published in 2021 about rural caregiving, it was explained that caregivers in rural communities know the people around them and acknowledge that there can be fewer formal supports. So this is why the people you know need to be part of that circle of support. Building a circle of support around you is one of the first things you can do for your own health and well-being. This could mean asking or accepting help from family members or friends, or looking to a professional service. The toolkit I mentioned earlier, called the I Am a Caregiver Toolkit, is really helpful for this. It helps caregivers to reflect on the many tasks that they manage, where they might need some extra help, and who they might be able to ask. If you have children in school, the connection within the school system may be another avenue of emotional support and can also be an access point for information for between families and professionals. Oftentimes, we hear caregivers say that they just want to talk to someone that understands, someone that gets it, and maybe someone that can offer some practical advice. Many organizations offer different sorts of peer support, whether it be in person or virtual. And OCO is one of those. We offer two types of peer support. So we offer online support groups who are led by facilitators who are or have been caregivers themselves. There are several groups to choose from, offered on different days and times of the week, and most of them run about twice a month. OCO also offers one-on-one peer support. So this is when experienced caregivers can sign up to be mentors because they know best just how challenging it can be to be a caregiver, and which is why we connect them with another, usually less experienced caregiver by telephone on a frequency that works for both the mentor and the mentees, for their schedules and whatever frequency that works for them. And we have found that it has been extremely beneficial for the people that are involved in the program. Mentoring is just one method of passing on lived experiences to support another caregiver and in an empowering and meaningful way. These matches last up to 6 months, and the mentors receive training from OCO on how to be a mentor. But more importantly, they have a wealth of experience and knowledge, which can help another caregiver with the challenges of their own caregiving situation. And caregivers can be matched with a mentor on many different for many different ways, whether it be they are caring for someone in a with a like diagnosis, or caring for someone with a similar relationship to the person they're caring for, like a daughter caring for a mother. Or in this instance, it could be that they want to connect with another caregiver that understands what it's like to be a rural caregiver. So now I would like to invite Catherine to hop on camera, and I'm going to take down my slides, and we're going to have a little bit of a chat, and Catherine's going to share a bit about her experiences.
Hi, everybody. I'm Catherine, and as mentioned in the introduction, I've been supporting my husband through his mental health journey over the last, I'd say, about 10 years. And we were very fortunate and lucky to have an amazing child and in 2020. And after a difficult journey, to bring him in here to this world. And he was diagnosed with a really rare genetic disorder. And as a result of the disorder. He died, and he in December 2022. Um, in those 2 years that my son, his name was Riker, that was alive, I learned more about caregiving than from a personal experience than I did in the career that I have in healthcare and with my journey with my husband as because he's an adult. I lived in a rural community at the time, and I was living there for about 12 years. And then, so the first year of my son's life, I lived in a rural community. And then I moved when he was like 1 to 2.5 into his death into a more urban area, but not because of him. It was because of my line of work. And so from the I can give two perspectives of what it's like because I still live in Northern Ontario, but living in a very small community that had 5,000 people in it, there was a sense of community, and I loved that. My neighbor, I didn't have any family in the community, and neither did my husband. But our neighbors and our friends in that community helped us. Um, the first time my son became very sick, he was 2 months old, and everybody in my street knew there was a newborn on the street. And I remember my neighbor said after the fact that she knew something was wrong because we were back in and out of our house very quickly. And my son ended up having a seizure, and I had went into our local community hospital, and the physician at the time had said that he couldn't find anything wrong with my son, but I had this gut feeling. But I'm a new mother. I just found that my son was very, very lethargic. Later that evening, and no, he wasn't eating. And later that evening, I was still having difficulties breastfeeding him. My husband attempted to feed him through bottle, and that wasn't working. So he hadn't eaten or drank any milk at this point, probably in about 12 hours. My husband tried, and he had told me across another room that he felt that my son was having a seizure. I told him right away, like, bring him to me. And I looked at him and I instantly knew. And I was like, I don't know. I just went into this mode of like, we have to record him in the seizure moment. So that's what happened. So we went back to our community hospital. And it was still the same doctor on, showed him the video. And then he's like, you need to go into the major hospital. So the major hospital was about an hour away. And there was no ambulances in the ambulance bay where we were. And so we had to make this executive decision of were we going to wait for an ambulance to show up, or do we speed down Highway 17 in Northern Ontario and get to our major hospital? They knew that we were coming, so we elected to drive and hopefully not get stopped by police, which we didn't. We presented the hospital. We didn't have to present to emerge. We went right up to the pediatric unit. We were put in a ward, and we just waited. And again, this is like 4 o'clock in the morning. And 5 hours later, so now my son hasn't eaten in almost 24 hours. And he went into full tonic-clonic seizures, and he was transferred to the NICU at the major hospital in our region. And within by 1 o'clock in the morning, I was on a flight to with Orange, in the actual helicopter Orange, to SickKids. I was by myself, and at this point, I felt, oh, my hat's starting to turn where I'm not a mother, but my caregiving journey is about to begin. And being by myself with the 2-month-old, transferred to the ED, and the SickKids was transferred to the critical care unit. And this is in the height of COVID. This is August of 2020. I have not slept in hours as a parent. And for the women in the group that are mothers, I was an overproducer, and I'm still having to work through that through my body too, and being pumping. And then just emotional, obviously. And so my son was in the critical care unit of SickKids, and all these people were there asking me repeatedly, what happened? I don't know, at this point, I probably repeated my story like 60 times from a community hospital to the next major hospital to SickKids, and then the different teams at SickKids, and it's changeover of different teams as well, right? I finally was able to get some rest at 4 o'clock in the morning when the nurse was like, I'm like, I need to sleep. And she brought in this cot for me to sleep. And it was typically normally something that they didn't do based on the acuity of the room. And as soon as I laid down for like 15 minutes, she nudged me and woke me up and said, the doctors need to talk to you. And they're all waiting for you in this case conference room. Remember, I'm by myself. So I presented to the room. The doctors told me that they thought my son had this really, really rare disease, a different rare disease than what he was diagnosed with, and that he's going to pass away very shortly. And so I'm taking this news that my son's going to die in a matter of days. And how do you like take in that information when you're alone? I don't have my husband with me. My parents fortunately live in the Greater Toronto area, but they're across the city, but they know I'm there. So the strong advocate that I am of people who know me, I was like, this is what we're gonna do. And then I literally said it to them like that. I'm like, we're gonna repeat this story tomorrow when my husband comes, because he has to drive down from Northern Ontario. He has to close our house down. He has to pack our clothes. We had a dog and we had to find somebody to, take care of our dog. We have food in the fridge. Like, we don't know how long we're going to be. These are things that caregivers have to do abruptly. And remember, I don't really have anybody in my community. Like, I have my neighbors, but I'm not like collegial with them on a regular basis. It's like a hello, how are you doing as I'm walking my dog down the street. So I didn't have really those strong connections at the time. And so that was happening. So I had told the healthcare professionals, like, we need to have a repeat conversation with my husband in present, because I cannot deliver this information to him and be this bearer of information. And then everybody's going to start asking me. And I requested that my parents come as well, because there was height of COVID and there was a lot of restrictions and policies in place, which we were respectful of, and they agreed. And so that's what happened. And so that night, my parents picked me up, and it was the only night I didn't sleep in sick kids. But and I don't think it was a mistake. I think I needed to leave that environment, but I really didn't sleep well because I wasn't with my son. And my husband came, and then like we went back into the city that next day and had these conversations. And yes, we were told my son was end of life. And we moved into a children's hospice with him, and we planned his funeral. And we had a great time trying to live out his end of life days with our first child and have it joyous. Fortunately, we're one of the very lucky families where our child didn't die, and we were able to take him home. He had some symptom improvement, but we didn't know what was wrong with him. So this was 3 weeks later. We had lifted a DNR, had a plan in place, and I'm skipping things along the way, but this is a brief moment in my son's journey, and a very important one. But we lifted the DNR, and we were able to go back to Northern Ontario. So my son is about 3 months now, and in September, I'm on parental leave, and because he has this end of life diagnosis, we had to make a decision to change what our parental leave would look like. So I'm still receiving maternity benefits, but if your child dies while you're in parental benefits, your benefits are seized. So we decided that my husband would go right into taking the parental benefit while I was still on the maternal benefit, so that we could still capitalize on some type of financial, and then I could go into the compassionate care, critical care benefits. So that's kind of what we did from a financial perspective, and these are lived realities. And he didn't die, and so again, he lived again, and so it kind of, because we were told all these things that impacted our finances, we made a decision. So my husband took some of the parental leave benefit. My son didn't die, and then like I didn't have money for a while. I lost a lot of those weeks of parental benefits because of what we were told. We made it work, but it was very difficult. My son started not reaching his developmental milestones. And as soon as that we came back to Northern Ontario, we had great plans in place. And I'm very, very fortunate that it's not often that children die who are not in a population of oncology. And so we were able to have the pediatric oncology nurse come into our house. We did some more end of life stuff and come and check on my son weekly. And we were able to transition that to home and community care to checking his vitals. And then we were provided with a pediatrician right away. So that was connected between sick kids and our regional hospital. And so there's a lot of successes, but a lot of challenges as anybody who's a caregiver knows. And I want to highlight the good and the bad. And so again, not reaching his milestones. And then the plethora of appointments just started because he's not sitting up. He's not just reaching anything. He's just still cooing. The consonants are not coming. He's not babbling. So it's he's not meeting his weight. So, dietitian, and on top of meeting the pediatrician biweekly and home and community care coming in and checking his vitals, we now have an infant development screening person coming in and doing appointments. He's referred to physiotherapy and occupational therapy and dietetics, and then that's just locally, and then all the sick kids teams as well. So it becomes really daunting. And the thing is that every time my son had an appointment, I had to drive with him 50 minutes, and he's an infant, so he's still typical in his developmental patterns where he needs to nap. I need to feed him. So again, if you know Northern Ontario, there's not really there's not a lot of there's no en routes like where I live. I can't stop on an en route and just I'm sitting pulling my car at the side of Highway 17, breastfeeding him in my car, or like being in that in between space between the east and westbound section, and that's what I had to do. Or after his appointments, I leave the hospital and I'm breastfeeding him before I need to get back onto the highway. So those are some of the challenges that I faced. But I was equipped with I was hooked up with a social worker, and that was an amazing experience. And some of the resources that I used locally when I was living in a rural community, and it was a very profound relationship that helped me start understanding what my caregiving journey is going to look like, and when I'm a parent, and when I'm a caregiver to my son. I was introduced, I knew about the Ontario Caregiver Organization through my line of work. But that's when it was I think in its infancy and starting to become where it is today. And so I was like, what is this? Let me see, because I have a passion for caregiving and seeing it through family and friends. And again, I guess it's my place of employment. And I said, it can't be too prideful. Sometimes it's hard to bite that bullet. But I told my husband, I'm like, I love you, but I need help. It can't just be you and I anymore. And so I looked into the SCALE program, and I remember I didn't fully commit to it, but there was modules that I took. And then I was like, I need to talk to somebody. I have a great relationship with my siblings and my parents, but I needed somebody who understood, and I needed a lived experience. And that's when I was like, I think I was just done. I was exhausted. I felt isolated on top of COVID and living socially isolated in a rural community. And I reached out to the Ontario Caregiver Organization and asked if I could have a peer mentor. And at the time, it wasn't, I don't think it still is, but they were like, we can't guarantee that you're going to have somebody that is kind of going through a similar journey. But luckily I was matched to a person who had a child with a complex rare disease and lived in a rural area too of Ontario, not in the north, but they lived somewhere else. And it had the most profound effect on me. And it sounds that I'm trying to advertise the OCO, and I'm really not. That was my time. That was my time for myself. My husband knew that I had these appointments. I remember we would talk, and I'm going on our patio, and I'm going to have my glass of wine and talk to my peer mentor, and we're going to have discussions about, and I was able to confide in her, and she would provide me with resources and things that I could look into my community. And she provided me with more information than my healthcare providers knew of resources, especially from the child sector. So, which I carry on. I still tell people, when I meet, I'm like, did you know this existed? Facebook groups and different organizations, and how to get used equipment, and how to, advocate for yourself with writing letters. I remember she gave me samples. She would send me samples of letters that she used to, engage the Lions Club or the Shriners or different, those different type of organizations that exist locally in communities. The worst somebody can say is no, and that's what she always reminded me of. And so I really took that forth. And then I carried on that relationship for 6 months. And when it didn't need to happen anymore, actually, it was a little bit longer, sorry. It felt like it was done. It was great. And I was in it, and it became in a I was in a good place. I financially, there was always struggles with our husband, especially as the needs of our son, not always, sorry, but as the needs of our son became apparent, the finances started to come like, oh, how are we going to do this? And I got a little bit of funding and, we received a little bit of funding and we were like, for respite services. But I was on parental leave and I was like, no, I don't want to use these yet until I go back to work. And I told myself I was going to go back to work, hell or high water. Sorry, excuse my language. But I was like, I'm just determined until I couldn't do it. So what happened was we bought a second place because I lived in my work was in another town, which was like 4 hours away. And I went there with my son. Me and my husband had a plan that if I couldn't do it anymore, um, one of us is going to quit our jobs or somebody's going to try to get a transfer back. I tried it for 5 months. It was very difficult. Cried to my husband, missed him. He works shift work. I work Monday to Friday. He's missing his son. He's missing his wife. Likewise to me. And my son was in daycare, which was great. And I had that support from a community daycare so that I could go to work. And I realized that a lot of parents don't have that afforded opportunity because my son's daycare was able to successfully get some funding for an enhanced staff member because my son needed 24-hour or full day support because he can't feed himself and he can't sit up and he can't communicate. For he was a year now. And so I made it work, and then but like after work, I'm working Monday to Friday. My our healthcare providers are really great that I was able to not have to take off a lot of time off work and schedule appointments in the evening via virtually or come to the house or go into their organization. So that worked. And those were wins. But it was still a challenge in my personal life with my partner. And we were just angry with each other because we loved our son. But this is a really challenging thing to do is to raise when your ideology change of what you want and it's not the reality. And your friends and your family want to support you, but sometimes you just don't know how. So my husband, it was moved to the urban city that we live now, and we made it work. But my son, we had to sell our house in our rural community. We both have full-time jobs. We have no family to support us. They're just not located close to us. I put it that way. I'm not saying we didn't have family support. We did. But then on top of that, my son was admitted every month until his death. April, May, June, August, September, October, November, and December of 2022. Not for a day, for 4 days, 5 days at a time. I was also pregnant with my daughter. And I would stay in the hospital during the day to allow my husband to go to work. And then he would come in at night and relieve me, and I would go home so I could have a proper sleep because I was pregnant. And so we did this, and it was very difficult. And I'm not going to say it wasn't. It really was. It was hard. And I still don't know how I did it. And people ask me how I did it, and I don't know. I think it's love. That's what it comes down to. But yeah, ultimately my son, we did receive his diagnosis when he was 10 months old. He was diagnosed with a really, really rare genetic disorder. And we were told that his estimated life expectancy would be between 4 and 5 years of age. And that's what we lived with. Some people knew that. We didn't tell the world. I wasn't big on social media. I just wanted to capitalize on my time with him and my time with my husband and trying to make some sense of normalcy. And I think that's what I did for myself was just limit my social media to posting and stuff about our journey. So when he died, a lot of people didn't know how difficult our journey was. And I also didn't tell people when he was really end of life. My son had a stroke the day after I delivered my daughter. And I was in recovery, and we got a call that he was in the ED. My husband went upstairs and in our urban community hospital to go be with my son. He was eventually transferred down to the unit because the pediatric maternity unit are all kind of in the same area. Yeah, I wheeled my newborn over to the other unit, and we were there together, and we were just waiting for Orange to come. It was a difficult time then in November 2022 with pediatric beds. He could have been sent anywhere. I think there was around the time of the RSV cases, among other things. And my husband flew out with him, and I literally said goodbye. I knew when I walked into the room with my husband and my son, like this was it. So I said my goodbyes to my son. I said I was going to be okay. And, we had a conversation and with my husband, we were very open with each other about end of life care with my son. We had conversations because we had already been through it. So it's not to say it wasn't a shock. It was, because I didn't expect my son to have a repeated stroke. He had a stroke 6 weeks prior, but he made a recovery. And so when he had it again, I wasn't prepared for it. I had a plan in place in my head of like how I was going to have my daughter, and I was going to try and get into Holland Bloorview, and made a plan with my parents about like how we're going to make this work. And so I just needed some time to deliver my daughter before I continued on his rehabilitation. So when that things happened, I was able to make it. And when my daughter was 5 days old, I flew with her on Air Canada flight. I bought her a seat. Ironically, you can't buy a seat for a newborn. You have to be over 5 days of age. So I had to get all this paperwork at midnight. Pediatrician on call in the hospital to fill out this paperwork to get so that Air Canada medical could get medical clearance for both of us. But it was successful, and I was able to get it, and I was able to buy my ticket on Monday. I flew it on Tuesday. I had to close down my house here. I had to pack stuff. Again, my husband was on Orange, so he has limited stuff. And we have a dog, so I had to take care of the dog. I had to close out all the food in my fridge, like that opposite thing. But I have a newborn, so I'm still breastfeeding and not sleeping and all of that. But we made it to London, and I was very fortunate to have one of my greatest friends who lives in there picking me up from the airport, drove me to Ronald McDonald House, and I dropped my stuff off and went and we saw my husband with my son and my daughter. And we started that. My husband had asked me to make that final decision, even that he was telling me, via text for the last couple of days, like, I've requested this not happen anymore. But so we came to a decision, and we said to make him not in pain and just peaceful, not hurting. So I lived in London, for the next 3 weeks until he died. And then the caregiving journey kind of doesn't stop. There was a sense of relief, I'll be honest, when Riker died. The everydays were very tough. But I have to plan his funeral, and those things cost money. Child are not free to bury. So you can't bury a child unless like the plots are paid for, all of those things you have to consider where you're going to get all that money. And my parents gifted me a plot. So I was very happy, very fortunate that they had that. And, 24 hours after he's died, we had to figure out how we're going to get to my parents, because we're in London, they're in the GTA. So we had to rent a car because we didn't have any vehicle means with our newborn. I had the car seat and a stroller, so that was a win. But yeah, so we had to rent a vehicle. We did it for one way, so that was money. And then, I have to deliver news to people that my son has died. The day that he died, I stayed with him for 3 hours until I couldn't anymore. But it's very painful, the death process. I missed his death, his last breaths. But he was still warm, but I held him until he was rigor. That's part of caregiving. Until the rigor set in, and it did quickly. Um, the nursing team and the palliative care team at London were exceptional, and they gave us a space. They held my daughter while I was just alone in my room with my son for the 3 hours. My husband was already gone at that point because he has to figure out how we're going to get the car, and we each process things differently. Yeah, so we went to Toronto. He died on a Saturday. Monday I'm at the funeral home. And I'm not grieving yet. Like, you have planning, and I think we sometimes forget that. And so we had his funeral on a Friday purposely because I didn't want a lot of people there. And he was buried in the GTA, but half of our family is in Northern Ontario. So some people came, but again, selfishly, I didn't. If I had it on a Saturday, I knew a lot more other people would show up. And so yeah, and then it was Christmas. It was December when he died, and dealing with that, and just everything that comes in between. And so about a month after is when my grief set in. When it dies down, the thank yous, the calls, nobody dropping off food, and then it started from there. And I still have to close off his life too. His health card needs to be closed off. He had a passport, he had life insurance, that activated some issues. Receiving his death certificate in April, 5 months after he died was very difficult to get that in the mail. It made a realization that he was gone. The first birthday, knowing that his sister was surpassing his milestones and that I was becoming a parent again, not a caregiver. And the challenge of getting support for grief is a thing too. So those are some of the things that I've gone through, but I've had support and some amazing resources. Like I said, was a scale program and being a peer mentor, and some books that I wrote down. There's this book called The Boy, the Mole, the Fox, and the Horse that my grief counselor gave me. It's a children's book, and it's so powerful. I read it in 30 minutes. Like, it's amazing. It's a children's book, but it's for everybody. And I'm not trying to again advertise, but that was a really great book in my grief journey. And It's Okay to Not Be Okay was another one, and doesn't have to be end of life grief. That's when I read it, because that's when I was told about it. But I think it's a good resource. There was Swallowed by a Snake that I read too that was mentioned, and it's about understanding masculine side of healing, and that really helped me understand what my husband was going through, because I'm a very expressive person and he's very inward, and I thought he wasn't feeling the same thing. And I was like, you don't care that he's gone, and it really led to a lot of fights and turmoil between our relationship right after my son died. I really believe in the power of therapy. I did start it a bit with Riker, but I wish I did it more consistently. But individually, we did our own psychotherapy. We went to couples therapy, and we also had grief counseling. Grief counseling was a challenge, but I was able to get support through our hospice here to have individual grief counseling, and then Sick Kids has an amazing grief counseling support. So that was really, really helpful, and I continue to use their grief support services virtually. Other people that were helpful in the journey where I was listening to the webinar, and I was like, oh yeah, the pharmacist. Oh Lord, the pharmacists were so amazing, and the pharmacy techs that my son belonged to. I'm so happy. Like, they're great people, and checking, and when meds were low, and just difficulties and challenging, and trying to help, and getting information from the nurses and the doctors, and just trying to make that little aspect a little bit more seamless. I would say be your authentic self, really, through your caregiving journey. Yeah.
Thank you so much, Catherine. There so many tools, tips, books for us all to check out. Thank you so much for sharing about your experiences and for being such a strong advocate for caregivers. We really appreciate you being here.
Thank you so much. I'm so sorry. I didn't realize the time.
It's okay. Thank you. And lots of really wonderful comments and feedback in the chat. And just, we so appreciate your willingness to share such a personal and emotional, real life story with all of us today. Unfortunately, we are out of time. I know we had some questions that we wanted to ask, but I think through Hannah's presentation and your story and those tips you shared at the end, Catherine, we've got some takeaways for folks today. And just a reminder to everyone that the recording, the slides, resources, and we'll get the names of those books that Catherine just shared and get them out to everyone who's registered for today. But I do want to thank you both. I want to thank Hannah for stepping in and joining us to share some really great information and resources available to support rural and remote caregivers. And of course, Catherine, for sharing your personal experiences caregiving and the struggles in rural communities, transportation, healthcare, all of these things, but knowing that there are some hope, there's some hope, there's some resources, there's some positivity there as well. So thank you both for sharing your time and your experience with us today. We so appreciate it.